Today is Tuesday, November 10, 2020, and we are going to be covering Module 1A on Semen Analysis. My name is Ashok Agarwal. I am the host of this program for the next 2 hours. So welcome to all of you, and we are ready to begin now. I want to declare that we don't have any conflict of interest. As you can see, the program was completely organized by the support from our center, and no companies or outside entities were contacted for any kind of sponsorship. Webcasting was supported by our Cleveland Clinic IT division, David Reichling and David Wolfley. Course faculty have donated their time for this online training. Program coordinators, and we have 7 of them who have volunteered their time for this training. And more importantly, the names, images, and description of certain products or instruments which you will see during the lectures are being used routinely in our andrology lab, and we are not endorsing any of these as speakers. So today's program is going to be including Module 1A, which is Manual Semen Analysis, which you have seen in the announcements that we have provided you. I am in charge of the andrology program at Cleveland Clinic, and I'm also the director of the American Center for Reproductive Medicine. I wear a couple of different hats. I am very much involved in managing the diagnostic lab of the Cleveland Clinic, as well as our program in male infertility research in Cleveland Clinic. We are recognized as the #1 program in the world in the fields of male infertility, andrology, and human-assisted reproduction. And this is based on the number of peer-reviewed publications, based on the number of citation scores that we have, and also based on the H index. And these are the numbers that anybody can check anywhere in the world. If you go into Scopus database that rates every single researcher or author in the world. We have a large number of medical textbooks that we have written. More importantly, our program has trained over 1,000 scientists, clinicians, graduate, undergraduate students from United States and from all over the world. So I'm very fortunate to be running this program along with the very talented team of people who you will meet some of them today. I spent about 10 years at Harvard Medical School, where I was the director of male infertility research in urology at Brigham and Women's, and also an assistant professor at Harvard Medical School. So now let's talk about the program. That is enough of my introduction. I want to now introduce the second speaker of the program. This is Dr. Sajal Gupta. Dr. Gupta is the technical supervisor of the Andrology Center and the reproductive tissue banks for over 12 years. She is a trained OBGYN, have done fellowships in reproductive medicine, as well as in the research. She has earned a number of awards, and she is also an assistant professor in the Cleveland Clinic. And she is the leader of our andrology lab. So I want to ask her to begin her presentation. And she is going to be speaking about the quality control in an andrology lab. Dr. Gupta can present now. The control of this program is, the slideshow is being done from my office. So I will move the slide when she tells next. So Dr. Gupta, Sajal, you can begin the presentation.
Thank you very much, Dr. Agarwal, and welcome to all the participants. It's my pleasure to speak today on the topic introduced by Dr. Agarwal. And the learning objectives of my topic are definition of quality control as it is applied to a male infertility evaluation or an andrology lab, quality control in the 3 phases of testing. So on the right side, I've provided an example of a laboratory workflow where the 3 phases of testing are shown as pre-analytical, analytical, and post-analytical. Then the significance of quality control, and finally, a few key take-home points. Next slide. Next slide. So let me define quality control for you. Quality control allows the lab to establish quality indicators for the lab equipment, the procedures or the standard operating protocols, the technologists who are the testing personnel, and thus ensuring that they meet the established criteria of accuracy. So how is this achieved? Basically, quality control includes all activities or operational techniques which are carried out to meet the quality requirements for a particular process or a product. So just to give you an example and make it a little interesting, a product could be from a manufacturing unit like a Mercedes-Benz car. So every time we go to the showroom, we get a perfect car. So there are processes in place which ensure that the quality of the product is excellent. And for the male infertility evaluation lab, it is the test results or the processes that are involved in testing which should meet the quality indicators, and the lab has to set up quality indicators or benchmarks for each of the process to ensure that we are meeting the quality control criteria and that the results that the lab is reporting are accurate and produced efficiently. So the elements that the quality control gets applied to is the equipment. The equipment has to be of the right functionality. You can see in the first blue box, and there are steps that you conduct every day, including daily quality control checks, calibration of the equipment to make sure that the equipment is functioning correctly. The second element is the standard operating procedures or the protocols. So all of the procedures that are done, and this applies to all processes within the lab. It includes having a standard operating procedure for quality control itself, for all of the tests that are done within the lab, and delegating the various functions within the lab. To provide an example, I have shown that for semen analysis assessment, the technologist or the testing staff has to follow a standard procedure and do it as it is laid out and broken down into steps within the procedure. Also, within the SOP, you have the reference ranges. So the reference ranges are provided as per the WHO 5th edition guidelines in the male infertility evaluation lab. The technologists are a very important element of the testing process, and it is necessary that the technologists are trained to a high standard. And why is this important? Because you want to ensure that your technologists are competent and they're producing the results which are accurate and precise. So how do we test the training of these technologists? We do what is called annual competency checks. And I will be providing, to make this presentation more interesting, I will provide actual examples of how we do the competency checks. And then there is external quality control, which is the proficiency testing, and the proficiency materials are sent by certain accreditation bodies. In the United States, we have the College of American Pathologists, from whom we receive these analytes twice a year, and these are tested by the technologists to assure that the testing process within the laboratory is being conducted correctly. Next slide, please. So this is an actual example of a competency checklist, and this is as it applies to the basic semen analysis procedure. And all of the procedure is broken down into steps. The first being we quiz I, as a supervisor, conduct these competency checks because I am deemed by the accreditation agencies to be competent to conduct the competency checks for the technologists. So how do I do this? I directly observe the technologists while they're performing the test. I quiz them. I look at each step, and all of the steps are listed here: the macroscopic examination, the microscopic examination, and I check all steps all the way through to make sure that they are performing correctly, and then also provide them with some constructive feedback. Or if they are lacking in any area, then I give them feedback. Like in the first box, you see the comment that they need to review more in details the criteria for counting the cells. Next. So once they have been checked off on all the components, they are classified as competent in performing the basic semen analysis test. But if they have failed, then I will go back and redo the competency assessment, and only after they have been deemed competent are they allowed to do the testing in the lab. Next slide, please. So quality control is defined as being applied to 3 phases of testing. So the pre-analytical phase, analytical, and the post-analytical phase. So here, the first phase is before the patient comes to the lab. He will go to the physician or the male infertility evaluation consultant, and he will consult, and the physician will arrive at a diagnosis. It could be primary infertility, it could be secondary infertility, or whatever were the findings or the history, depending on that. And then the physician orders the test. So the physician could order a semen analysis or some ancillary tests based upon the reproductive history and the examination, like a retrograde sperm count. So the second component is the actual testing, which is the semen analysis, and we will perform as per the orders from the physician. And then finally, based upon the semen analysis, the sample will be classified as normal or abnormal semen quality. And this is done per the WHO 5th edition guidelines, and meeting all the regulations of the College of American Pathologists, as well as other accreditation bodies like FDA, Food or Drug Administration. And this is achieved by continuous quality control monitoring on each of the steps along the way. Next slide. Each lab has to set up the quality tasks. So each lab can set up schedules on a daily quality control, the second weekly quality control, and monthly quality control. And I've just provided a few examples, like our daily quality control is the first thing we do in the lab is count the QC beads, which is the quality control beads for sperm concentration in a counting chamber. And once we meet the criteria for accuracy, then the lab is ready for testing for that day. And to give an example of weekly quality control, testing the IVR stations, making sure your employees are safe in the lab. Monthly quality control of doing checks of the inventory or checking and removing any expired reagents or supplies. Next slide, please. So what are the pre-analytical indicators or benchmarks for quality control? On the left side, I provided examples of some of the indicators looking at incorrect test requisitions. The physician has ordered a sperm count instead of semen analysis for infertility evaluation. So this is an incorrect test because it will not provide the complete evaluation that is necessary for infertility evaluation, or there are no orders, or the physician did not add a diagnosis code. The second indicator is the patient appointments. So we need to monitor within our lab the delay in getting patient appointments, or the patient has a long waiting time in the lab. And this may lead to patient complaints. So this is an important quality indicator to be monitored for an andrology lab. On the right side, you can see there is a graph that I've depicted, and this is a patient satisfaction survey on the length of time for an appointment within the andrology lab. So we see that 50% of the patients, we exceeded the expectations, 45% of the patients we met the expectations. So this is an excellent result, with 95% of the patients being very satisfied in terms of getting the appointment. The third criteria that needs to be examined for quality control is specimen rejection criteria, and it includes delay in transport or the sample not being labeled with 2 patient identifiers is an immediate cause for specimen rejection. Next. Going on to each lab must have a documentation of their specimen acceptance and rejection criteria. And these apply to the sample collection container, the transport conditions, and time to analysis. So I have provided some of the reasons that the sample can be rejected if it's a non-sterile container or the collection container failed the toxicity testing, or the time to analysis is more than 60 minutes because the results will be suboptimal. Next. Next slide, please. Another element which needs to be examined is the quality control of reagents in an andrology lab. Here on the right side, I have shown quality control for gradient media, and we had an old lot of the lower phase, which we have compared with the new lot of the lower phase. So we always compare the old lot versus the new, and then we split the sample and run the gradient media preparation, and then we examine the % recovery of the total motile sperm. So we calculated, and the % total motile recovery ratio is then examined. And in the red box, you can see that the acceptable gradient media quality control, the % recovery of the total motile with the new lot is, the ratio is examined to the % total motile recovery with the old lot, and this needs to be greater than 50%. So this is our quality indicator, and the ratio was 92% in this case. So I have reviewed on the right side, and then I have passed that this lower phase is ready to be used in the laboratory. Next. Analytical quality control is the second step in the process of testing. So here, instrument function checks need to be done with the incubator, the temperature checks, the ambient temperature checks, the pipette calibration. And the most important is the training, competency, and proficiency of the technologists. So the technologists are trained in the standard procedures. I provided an example earlier in my slide for the competency criteria, and they are assessed on the competency. Next. Next slide. And here I have shown you a standard operating procedure, which we have shown, which we have shared with you on the Dropbox. It is a SOP for the basic semen analysis. So each of the steps has been broken down with the purpose, the instructions for the patient, the specimen collection and delivery, and each of the steps is broken down for your review and understanding as to how important a procedure is in analytical quality control. Next. The instruments that are important in conducting a semen analysis, the pipette calibration, if it is not performed, an incorrect sample volume can be loaded. And as a result, on the second box, there is an impact on the sperm count and motility, and there will be an error in estimation of the count or the motility. On the right side, I have provided an actual example of pipettes that were calibrated in a lab with the coefficient of variation less than 10%, and then the pipette can be used in the lab. Next slide, please. Quality control of the incubators, the temperature checks, the humidity checks, because the temperature will impact the sperm motility. On the right side is an actual example from the andrology lab at the Cleveland Clinic. The range is provided 36 to 38. Each day you can see how well the quality control has been documented, and weekly quality control that is performed is also documented. Next. Reagents have to be stored as per the manufacturer instructions, either at ambient temperature. On the table on the left, you see the AccuBeads have to be stored at ambient temperature. The anti-sperm antibody testing control sera have to be refrigerated. So we monitor the ambient temperature as well to keep the reagents in the required range. Next slide, please. So For a semen analysis, the quality control for the sperm count is paramount. It is of extreme importance. And how do we test the reproducibility of the sperm count? So the procedure is to do the known concentration of latex beads or AccuBeads, and these come in two ranges, the low and the high. And on the right side, I've provided an example from the Andrology lab at the Cleveland Clinic of a Levey-Jennings chart. So what is plotted in this chart is the AccuBeads high value is plotted on the y-axis, and each day of testing is plotted on the x-axis. So the mean is calculated, which is the blue line, and then the yellow lines indicates the plus minus 2 standard deviations. On each day of testing, the concentration values for the high quality control beads are within plus minus 2 standard deviations, indicating the lab process is working well and there are no definite deviations. Next. I also wanted to show you an example of a deviation. This is a more elaborate record of over 100 days of testing of, again, high concentration beads. And in the red box, I've shown an example of a deviation. So what is this deviation? All of these values are less than the expected value, or which is the mean, EV, or the mean, and more than 10 values, if they are below the expected value, is a cause for concern because it indicates a systemic error. And one needs to look at if the technologist is not doing the procedure correctly, she may have to be retrained, or the machine is not performing well, then we have to recalibrate the machine. And till the time the quality control is met, the machine will not be used. Next. Sources of error in evaluating sperm concentration. So these are provided on the left side. You can make a note, you can review these and implement them within your lab. So your technologists are mindful that these are the errors that can happen, like incomplete mixing, dilution errors. And on the right side, I provided an actual quality control from our laboratory, where we do weekly quality control with a normal zoospermic sample, which is a normal subject or a donor. In the green box, you will appreciate that the manual count and manual motility is performed, and the same sample is then run on a computerized assisted semen analyzer. And the agreement between the manual concentration and motility and the CASA machine concentration and motility, and we actually did it with 2 machines, there was a high correlation or a high agreement. So that ensures that we are doing the right steps and ensuring quality control in our sperm concentration assessment. The red box just to indicate that documentation is everything for quality control in the lab. Whatever is not documented is not done. But we wanted to just highlight during the COVID period, we couldn't do the quality control, and this was documented. Next. And some more sources of error, like improper mixing, or the last box, it's the most important, inter or intra-technician variability. So how do we assess that the technician is performing well? By looking at inter-technician variability. And on the right side, there is a Bland-Altman plot where 2 technologists performed sperm motility assessment on the same samples. And then we have plotted the average total motility versus the difference in motility on the y-axis. And the mean and 2 standard deviations, the mean is the white line and the red dashed lines are the plus minus 2 standard deviations. And all of these values are within plus minus 2 standard deviations, showing that there is a high agreement on sperm motility assessment between the 2 technologists, and both technologists are performing well on the testing process. Next slide. Some more sources of error in assessing sperm motility, like conditions impacting sperm motility, temperature change, subjective bias. A technologist has subjective bias and is producing consistently high or low percent motility values, technical errors. They must avoid counting the chamber, the sperm at the edges of the fixed cell chamber. Next slide. Next slide. And then the last component is the post-analytical quality control. So how do we assess and what parameters we have set? So for this, we check the calculations. On the right side is a semen analysis worksheet from the Andrology lab at the Cleveland Clinic, and all of the parameters are checked, the calculations are checked. If there is any missing information or if the calculation is not correct, then we make that correction. And then once the results are okay, it is signed off. Next. These results are then manually transferred into electronic medical records. And this is a printout from the electronic medical records. And these are also reviewed and released to the physicians only after they have been validated and any corrections that have to be made are made. So if a correction is made, then in the electronic medical record, it will show as corrected results, and these are preceded by the uncorrected results. Thank you. Next slide. More indicators for post-analytical quality control, monitoring test time to analysis, monitoring the test turnaround times. So on the right, there is a table at the top showing gradient sperm prep review, and the time interval is looked at. It has to be less than 60 minutes, and all of the samples met this criteria. Or monitoring the test turnaround times, which is the threshold is in the lower box. You can appreciate less than 3 to 5 days, and all of the samples met this indicator. Next. So overall, the take-home message is to employ quality control within the male infertility evaluation to provide a high-quality semen analysis to all patients as well as the physicians. And so the physicians are confident of your results and can use it for diagnostic and therapeutic purposes to help the male infertility population group that they are seeing. And how is this achieved? By instituting strict implementation of internal and external quality control within the laboratory, which is also necessary for lab accreditation. I have highlighted several quality control tools that we use in our andrology lab at the Cleveland Clinic to achieve results that are accurate, reproducible, and reliable. Next slide. Next slide. So this is our group in the male infertility evaluation lab, and thank you for your attention. And this is our beautiful Cleveland Clinic campus. And I thank all of you for your attention. Thank you.
Thank you very much, Sajal. Thank you, Dr. Gupta, for a great presentation. So I want to thank my team here and many of our colleagues and trainees. These are many of our past trainees who came in front of the Andrology Center. The picture is in the front of the Andrology Center. And this is a picture of the Cleveland Clinic that you see here. A beautiful spring day. And one of our institution here, the big building, represents the cardiac center of the Cleveland Clinic. So thank you very much. This finishes the first talk, and you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ACRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.